Drew Rasco. I'm one of the Phase 1 medical oncologists here at START. I've been here for about 10 years, and I work on early phase clinical trials for patients with all types of advanced cancer, but I have a particular interest in gastrointestinal malignancies, including pancreatic cancer. The purpose of the trials is to test new anti-cancer therapies in patients who have already received some form of standard therapy. There's a big emphasis on safety, so making sure these drugs are safe and tolerable, but at the same time, we hope that the drugs will offer some form of benefit to the patients. Over time, we obviously have made a lot of strides in the treatment of cancer and cancer research, but we still have a long way to go. So we are constantly trying to push the envelope and move cancer treatment forward to hopefully improve outcomes for all patients all over the world. The misconception is that the patients would basically be treated as research subjects and not as patients with cancer. And we try to dispel those myths. We see the patients very often, so on average about once a week, so that we can be on top of any concerns or issues they may have. And I think the bottom line is we are trying to help patients get better. So they are part of a study, and there's a lot of interesting science that goes along with that, but the main focus is to try to treat the patient and try to help them get better. We also do not participate in any trials that involve a placebo, so if a patient enrolls on a study, they will be receiving the active treatment. There really are no placebos in early phase studies, so that should not be a concern. Most of the time they would be referred to one of the clinical trial doctors by their primary oncologist. However, patients are also free to make a self-referral. Whether or not they qualify depends on a multitude of factors. And so typically their treating oncologist would be the best person to kind of do that initial screening. But we're certainly happy to see patients who want to be evaluated for a clinical trial, and we would go over all of their history and their medications and so on to determine if they're a good fit for the trial or any of the trials. I'll address that on several levels. So one concern is patients are concerned that they're going to feel sick or that they're going to have many side effects. And ironically, what we tend to see is that patients on early phase studies typically have fewer side effects than they do on chemotherapy. And that's due to several reasons. One is that we are testing a range of doses, and so we may not be at the highest dose of the medication at all times. And secondly, the drugs work completely differently than chemotherapy. So they're really not what we would call conventional chemotherapy. As we mentioned before, they may be in the immunotherapy category. There are targeted therapies that target specific genes or proteins in cancer cells and hopefully leave the rest of the body unaffected. So I think by and large, patients tend to have fewer side effects than they do with traditional chemotherapy.